I feel very fortunate to be here because I'm from Wisconsin, and I can tell you, yeah, enough said, right? A month ago, I sent a friend of mine a picture of my thermometer, which said negative 23. He lives in, that was without the wind chill. He lives in Fort Pierce, which is just up the road here, and he quickly sent me a picture back of his thermometer that said 58. I won't tell you what I said next. So I'm here to talk to you today about Freelite. Anybody in the room here Freelite before? Few people? Good. If more people raise their hand, then I would just leave because you would know everything. So Freelite is a product that's manufactured by The Binding Site. The Binding Site is an in vitro diagnostic manufacturer, and that's a fancy way of saying that we're a company that makes products that laboratories and physicians use to help patients, either monitor patients or diagnose patients. We have 30 years of experience being an in vitro diagnostic manufacturer, and we specialize in making diagnostic tests that specifically target cancers and diseases of the immune system. What that means is we don't make routine tests to check for routine things like cholesterol or glucose or diagnose infectious disease. We're specifically making complex tests that target cancer and immune system disorders. And in addition to that, we like to pride ourselves on making tests that are to really difficult targets, like Freelite chain, which you're going to hear a lot about in the next couple of minutes here. So the Binding Site's located in Birmingham, England. For those of you that don't know, Birmingham is right in the middle of the country, located in the British Midlands, beautiful part of England, if you haven't gotten a chance to see it. This is what the building looks like. This is the headquarters. All of our products are manufactured here. I'll tell you a quick funny story about this building. When I interviewed for a job at the Binding Site, they put me up at the Marriott Hotel, which is right across the street from this building. You can't see it in the picture. And I flew in the night before, and I had an interview early the next morning, but they never gave me the address of the office. So I'm sitting in the Marriott, and I'm eating dinner, and I'm thinking about my interview and what I'm going to say and how I'm going to get there in the morning, and I realize I don't have the address. And as I'm realizing I don't have the address, I look at this beautiful building with 40-foot immunoglobulin molecules on the windows, and I said, I bet you that's it. So the Binding Site thinks of itself as a different type of IVD manufacturer. And if you talk to people that work in IVD, I would think that most of them would say, well, my company's different. So I've worked at several, including the Binding Site, and I can tell you that the Binding Site is different. And we're different because we're very science-oriented. Of course, we have sales and marketing efforts. We're a company, but we're very science-oriented. And I took just 2 slides to demonstrate that all to you. So the first slide here, this shows that there's over 3,000 publications out in the public domain just on our one product, Freelite, alone. And most of those research studies have been conducted using reagents and kits that the Binding Site has given those researchers free of charge. We want researchers and physicians to utilize our products to find multiple and new applications to help patients like you. We want researchers and physicians to utilize our products and get back to us with performance limitations so we can improve those products. And we believe fervently that the more research we're in, the better we are able to do that. The second example I wanted to give you, I don't know if any other people are going to mention this, but the iStop study. And iStop stands for Iceland Stops, Treats, or Prevents Multiple Myeloma. This is a preeminent study that's going to tell us whether there is a benefit, both economic and health benefit, to screening broad populations for multiple myeloma. And we're doing this study right now in Iceland. This is part of the IMF's Black Swan Initiative, and the Black Swan Initiative is the push to a cure for multiple myeloma. And yes, I did say cure. Binding Site's not only a supporter of this study, they're one of the principal investigators of iStop. So I told you what Freelite is. It's an IVD. Now I want to tell you what it's used for. It's used to diagnose and monitor myeloma. And if we look at myeloma is a disease characterized by osteolytic bone lesions, which everyone in this room knows. And if we look at the moniker or the name multiple myeloma, multiple meaning many, myelo or myelos, which is very close to the Greek word for marrow or bone marrow, and then oma, the suffix for tumor, really this is a disease of many tumors of the bone marrow. Everyone knows this slide. You know, the signs and symptoms of multiple myeloma are many and varied depending on the individual, but some of the most common are bone pain or back pain and fatigue. Now realize that these symptoms are nonspecific. They're associated with many other types of diseases, but when they're chronic, persistent, and can't be explained by anything else, physicians should think myeloma. These symptoms are unlike the crab symptoms, which are much more specific for myeloma, and in fact are part of the diagnostic criteria for myeloma. If we look at the disease statistics for myeloma, the number of cases per year is projected over the next couple of decades to increase in both males and females and among all demographics that are listed here on this slide. Why is a disease like myeloma projected to increase with such significance over the next couple of years? Remember that myeloma, the highest incidence of disease, happens in the 5th, 6th, and 7th decade of life, usually. Not every case, right? As we just heard previous speaker. But that's when most disease hits. This slide always strikes me. So if you look at that age demographic, the 65 years and older in the US, from 2000 to 2010, the number of individuals that were 65 years or old in the US was 34.9 million people. 10 years later, it was 35.2 million. So essentially, the number of people that were 65 years or older during this decade remained unchanged. That is all rapidly changing. So from 2010 to 2030, we're projecting going from 40 million people over 65 to 71.4 million people over 65. That means that 10,000 people per day will turn 65, and that will continue till 2030. So if myeloma is a disease of the 5th and 6th, 7th decade of life, and we're going to have 71.4 million people that are 65 years or older, what's that going to do to the incidence of multiple myeloma, the number of cases? We are going to have lots of people that are diagnosed with myeloma and forced to live with myeloma, which means that we have to do a better job in learning how to diagnose, monitor, and treat multiple myeloma. And the good news is we are. So through the efforts of warriors like you, the efforts of healthcare professionals, that you're going to hear many of them over the next couple of days, organizations like the IMF, we are doing better. And if you look at what the 5-year survival rate was for multiple myeloma, less than 2 decades ago, it was just over 60%, about 62%. Now the 5-year survival rate is approaching 80. And where's it going to go beyond this? Someday we're going to have a cure. Why is that happening? We have improved efficacies of drug and treatment regimes. We're doing things today that we weren't doing 10 years ago. We're diagnosing the disease earlier. And we're using diagnostic methods with improved sensitivity. And that's where Freelite comes in. So far, I've told you what Freelite is. It's an IVD, in vitro diagnostic. I told you what Freelite's used for, to diagnose and monitor Freelite. Now I'm going to tell you how it works. And to understand how it works, you have to have a little bit of basic immunology training. Now don't panic. I'm going to take you through really slow, step by step. And when I describe this to groups, I always start with a slide that I think everybody can relate to, whether you're a physician, whether you're a PhD, whether you're a computer programmer or a truck driver. Everybody can relate to a drop of blood. So in a drop of blood, you have lots of red cells, red blood cells, and you have some white blood cells. And the function of red blood cells is to carry oxygen to your tissues. The normal function of white blood cells is to identify and destroy foreign invaders. So anytime your body gets exposed to bacteria or virus or fungi, it's the job of these guys to go ahead and identify them and destroy them. Now, white cells, just like red cells, are distributed all over your body, but they tend to concentrate in certain areas that we call lymphoid organs, primary and secondary lymphoid organs. Things like the thymus, the spleen, lymph nodes, and the bone marrow. And the bone marrow is a really special place because the bone marrow not only harbors white blood cells or concentrates white blood cells, but it's where white blood cells are manufactured and produced. Now, all cells in your body are derived from stem cells. We all know that, right? That's what a stem cell looks like, if you want to know. That's a scanning electron micrograph of a stem cell. And as I said, stem cells can differentiate into any cell type in your body, including white blood cells. This is a simplistic representation of all the types of white blood cells that are in your body. And I know it looks complicated, but trust me, it's simple. It's simplified. There's more than this. And the reason I show you this is because if you look at B cells, which are a type of lymphocyte, B cells terminally differentiate into plasma cells, and multiple myeloma is a malignancy of plasma cells. So if you have multiple myeloma, this is the lineage of cells that you have the malignancy in. Now let me tell you that people can have malignancies in any one of those cell types that are up here. They're not called multiple myeloma. They're called leukemia or lymphoma. But there are malignancies described in all of these cell types. It just so happens that multiple myeloma is a malignancy of plasma cells. Okay? If we were to take that same drop of blood that I mentioned on the previous slide, mix it with a little bit of certain types of dyes, smear it on a microscope slide, and look at that slide under the microscope, it would look like this. So you would see lots of red blood cells, small red blood cells. You would see these big white cells. And if you wanted to know what a plasma cell looks like, it's number 5. That's a plasma cell. So when your physician says we need to get another bone marrow, and a pathologist looks at that bone marrow sample, they're looking for plasma cells. This is what they're looking for underneath the microscope. They're looking for an inordinate number of those plasma cells. Plasma cells have a normal function. They're not just bad guys because they happen to be associated with multiple myeloma. They have a normal function. And their normal function is to produce immunoglobulin molecules or antibodies. Now, immunoglobulin molecules look like this. Immunoglobulin molecules or antibodies are really small. They're soluble proteins. They're much smaller than the cells that produce them. You can't see them under a microscope. They're soluble proteins. They consist of 2 identical heavy chains that are stuck together by a disulfide bond. And there's 5 different types of heavy chains that make up these immunoglobulin molecules: IgG, IgM, A, E, and D. Now, who's heard of these before? Everybody, right? Because when they immunofix or type your myeloma, they tell you what your isotype is, right? And what they're telling you is the type of heavy chain that is there. Okay? Most common form of multiple myeloma is which isotype? G. Yep. Also associated with those heavy chains are 2 identical light chains, either kappa or lambda. Now, an immunoglobulin molecule, it has to be kappa-kappa or lambda-lambda. You can't have 1 kappa and 1 lambda on the same molecule. These are called the light chains. So, in a normal plasma cell, you have a B cell. It terminally differentiates into a plasma cell. Each of these plasma cells create or manufacture, produce immunoglobulin molecules. And what they do is they manufacture heavy chains individually and light chains individually, and they paste them together. And these are fully functional immunoglobulin or antibody molecules. And these antibody molecules also have a normal function, a regular function. And that function is these antibodies bind to foreign invaders, like bacteria, viruses, fungi. And when these antibodies are bound, this host protein, when it's bound to those foreign invaders, it allows your immune system to rid your body of those invaders. So your system can do it much more efficiently if these antibodies are bound to those foreign invaders versus if they are not bound. What happens in multiple myeloma is you have a single plasma cell that becomes malignant, and the definition of any cancer or malignancy is instead of replicating or going through cell division once, which is what a normal cell is supposed to do, it doesn't do that. It proliferates or replicates over and over and over and over again. And what happens is you get copious amounts of immunoglobulin molecules and free light chains that are produced as a result of this proliferation of this malignancy. Now, just to confuse you, just to confuse the patient, physicians call the same thing by many different names. And this is something that's very throughout medicine, not just multiple myeloma. But these molecules here are called monoclonal proteins, M proteins, or paraproteins. Those are all different names for the same thing. Everybody's heard those, right? What's my M protein level, right? Okay, that's what this is about. We can use the products that malignant plasma cells secrete to differentiate what type of myeloma you have. So the most common type of myeloma is intact immunoglobulin or intact IG myeloma. It accounts for 80%. We have light chain only myeloma, which means those malignant plasma cells are only making light chain. They're not making the two heavy chains. And we have a third type, which is very rare, 1 to 5%, called non-secretory myeloma. And non-secretory myeloma are malignant plasma cells that don't secrete any immunoglobulin, heavy chain or light chain, or they secrete so little that we can't detect it. So we call them non-secretory. So how do we detect the products that a malignant plasma cell will produce? How do we detect those light chains and those heavy chains? So normally what we use is a process called serum protein electrophoresis. And I would venture to say that all of you that have been diagnosed have had this test. And it starts with a venipuncture, a blood draw, and you fill the tube with blood. You take this tube of blood and you put it in an instrument called a centrifuge, which spins it around really fast. And by centrifugal force, all the particulates in that sample will pellet. So all the big cells, like red cells and white cells, they all pellet to the bottom of the tube. And in the top, you're left with all the soluble components, the liquid components of blood. And we call that serum. And it's a straw-colored liquid. And in that liquid are the components or the things that plasma cells produce. So remember all those immunoglobulin molecules that I told you about that are real small and soluble? They're in there. They're in the serum. So if I take that serum and I mix it with a blue dye and I load it in a gel, and if I was to describe what this gel looks like, think of Jell-O, clear Jell-O. That's a real thin slice of clear Jell-O. So not a big block, a real thin slice of clear Jell-O. And I can load that serum sample with the blue dye onto that gel, and then I can apply an electric current across that gel, and that electric current will cause those proteins, because every protein in your body has a charge, either positive or negative. And remember, opposite charges attract, right? So this current will cause these proteins to migrate through the gel. What happens then is you end up with a profile. So in a normal person, so there's over 200 different proteins in your serum. And each one of these proteins, here's albumin, which is found in very high quantities, you get a band, right? Now we know that immunoglobulins, heavy chains and light chains, happen to be in the high beta region or in the gamma region. So everybody can see the difference between the monoclonal patient here and the normal profile. Notice that the monoclonal protein has a very dark, distinctive single band in the gamma region. And that's because the malignant plasma cells are producing immunoglobulin molecules that are identical. Lots of identical molecules. And so those identical molecules migrate to the same exact position in the gel. Where a normal person has a smear because their immunoglobulin molecules are all slightly different. They're not identical. Does that make sense? So
one quick note.
Yep.
I just want to make sure that if people have questions, since we only have 10 more minutes, so I just wanted to give you a heads up that if you have questions, now would probably be the time or the next few minutes. Okay?
Yep. I'll take them right at the end. I'll make sure we have time. So what's important to know that if you use serum protein electrophoresis as the only means to diagnose, SPE is a good test. It's available in lots of different labs. It's cheap. It's easy to use. But if that's the only test you use, you'll miss 1 out of 8 patients with multiple myeloma. That's where Freelite comes in. So Freelite's not a gel-based test. It's a nephelometry or turbidimetric-based test, which are fancy words to mean that it's performed on an automated box, an instrument that's a tabletop instrument, looks just like that. And what Freelite does is it measures objectively, not subjectively, the quantity of kappa free light chain and lambda free light chain. And it also gives you a ratio. And if you think about this, if in a normal patient, if you have plasma cells that are secreting both kappa and lambda, that's a good thing, right? Because that's a mix. If you have plasma cells that are only secreting kappa or only secreting lambda, that's indicative of a monoclonal process, right? Like multiple myeloma. So in a normal person, this kappa to lambda ratio is pretty close to normal. It's around 1. And if you get ratios that are highly skewed to the right, that's indicative of a kappa monoclonal process. To the left, that's indicative of a lambda monoclonal process. We know that when you pair serum protein electrophoresis with Freelite, the sensitivity approaches 100% diagnosis for multiple myeloma. In fact, it's so compelling that the IMWG included Freelite as one of the myeloma-defining events for diagnosis of myeloma. So now I told you what Freelite is. It's an IVD. I told you what it's used for, to diagnose and monitor, and I told you how it works. The last thing I'll show you is, in addition to diagnosis, Freelite can be used to monitor disease. So don't get too caught up on what these drugs are up here. I think these are out of date. But you can see that you can measure serially Freelite over time, and Freelite levels change as your therapy and disease changes. That helps you as a patient answer these types of questions. What stage is my disease? How bad is it? How far along am I? Is my treatment working? Is my tumor growing? You should also know that there is a question that I often get is, why do my Freelite values change so suddenly? Realize that, like any marker, Freelite, you are a biologic entity, a dynamic entity. And so there's biologic day-to-day variation in any protein that you would measure in your body. There's also what we call analytic variation. So one lab that runs Freelite will have a slightly different value than another lab. One lab that runs Freelite on an instrument B will have slightly different values than a lab that runs it on instrument C. So there's both analytic and biologic variation. Keep that in mind. And then the last thing I'll tell you is that if you have questions, go to our website. It's not just a commercial entity. There's lots of good stuff on that website. And if you have questions about what's on the website or you need more detailed information, you can always email me directly. And these are our sheep in Vermont that help us make a lot of the products that help you. Yes? I have like 2 minutes, 3 minutes for questions. Yep, go ahead.
When you had that chart up there that showed the humps,
Yeah.
the tall hump and then 3 little short ones and a big one,
Yep.
you said something about the gamma zone. what if that is low?
That's good. So that's good. That means if there's no M, we call it an M spike. And if there's no M spike, that means that there's no detectable monoclonal protein there.
Okay, so what if that other one was up a little bit? Oh,
So you're right, the normal one had sort of a smear, right? And so you want there to be no spike, no discernible spike, but you want there to be a smear. If there's no smear there at all, that's called hypogammaglobulin anemia, and that means you have no immunoglobulin or very little immunoglobulin present. That's a bad thing. So you want immunoglobulin there, you just don't want an M spike. You don't.
immunoglobulins you're talking about, is that the IgA, Ig?
That's correct.
The IgA, IgG, and,
That's correct. Remember, there's 5 types of immunoglobulin, G, A, M, D, E.
okay. Thank you.
One more, maybe?
You talked about there being a certain percentage difference depending upon both the lab and also biologics.
Yes.
So what makes that different? I mean, it being dehydrated, when you have the test, I mean, some insight into why your numbers might be so labile.
Yeah, so biologic variation could be anything. I mean, like you said, it could be dehydration, it could be a lot of things. Realize that the half-life, the serum half-life of light chains is pretty quick. So your serum light chain values can change pretty quickly.
Thank you.
It's really not that, it's often not that big a problem because when you get your blood drawn, the physician sends for a Freelite sample, they usually use the same lab, right? That uses the same kit, that uses the same instrument. Now, if a lot of you are, live in the north and then come down here in the winter and you're using different facilities, then it could be an issue. But usually it's not when you're seeing the same physician.
Okay, thank you very,
Yep.
very much.